if we could, how do I switch over from? Very good. I'm Ben Anderson. I am the one of the two co-chairs of today's Global Summit. This is the fourth Global Summit of the Breast Health Global Initiative, and our topic that we're addressing is the optimization of healthcare delivery in breast cancer, focusing on low and middle income countries. This fourth summit there's a series of firsts for us. First of all, this is the first time that the global summits have been an open meeting where we had open registration. The three prior summits that we'll talk about in a minute related to having invited experts to focus on specific topics. And this, for the first time, is an open discussion to invite people from the outside to participate and listen. What is not different in this global summit is that our major goal here over the next 3 days is actually not the meeting itself. The major goal of this meeting is what is going to be produced from this, which are the publications. We'll be having more detailed conversations about those publications, but we're pleased, as you're thinking through your dialogue, remember that what we're hoping to stimulate is a discussion that stimulates thoughts that will be of relevance to the global community. We have over 150 registrants for this meeting, representing 43 countries and 6 continents. And as such, this is the largest meeting that we've ever had. Another first for this meeting is our poster session. This has been an open poster session. We've had 5 traveling scholars, in addition to other registrants who've submitted 32 posters from 22 countries. And we'll be inviting you to observe the poster session later today and during the late afternoon session. And also, we will be having Breast Journal Awards on tomorrow afternoon, recognizing 3 of the many excellent posters that were submitted. I would like to thank the Breast Health Global Initiative team, led by Leslie Sullivan, the Managing Director of the Breast Health Global Initiative. Julia Chase, you've all been communicating with, has been doing fantastic work in coordinating this, and Marisa Hartman, who is back in Seattle, keeping us all pointed in the right direction. What I'd like to do now, and I'm going to review for this group because some have been involved in the Breast Health Global Initiative before, some have not. I'm going to go through an introductory session so that we're all on the same page about the work of the Breast Health Global Initiative. Prior to doing that, another first of this meeting is that the Breast Health Global Initiative is co-chairing this with a regional society, SLACOM, and its president, Dr. Eduardo Cazap, is the co-chairing this with us, and it will have an introductory word.
Thank you, Ben. Thank you everybody for coming. And why we are here? We are here because we consider that today cancer is one of the critical issues that our healthcare system are facing. In addition to this, breast cancer, it's a real priority, not only for rich countries, also for in middle-income and low-income countries. Breast cancer is an epidemic disease that affects each year 1,300,000 new cases all over the world. And 10% of those cases are in Latin America. One of the issues that were identified by several sources as a conflict were norms, regulations, or guidelines. As a short example, 3 or 4 years ago, in a survey performed by the ASCO Society, only with the international membership, that means about 15,000 oncologists all over the world, 2 issues were identified by our colleagues as a real and true priority: prevention and international guidelines. We were working at ASCO chairing a a group that is an informal group in order to develop international standards. Because the ASCO guidelines are used by less than 20% of the ASCO members. And other guidelines are not universally accepted. So one of the priorities of our society in Latin America was to develop guidelines for breast cancer. So we have 2 publications, one in Cancer 2 or 3 years ago about a picture of breast cancer in Latin America, the second published in the breast last year, preparing such a guidelines. But our results, surprisingly, resulted in that the majority of the countries in Latin America, they have guidelines, they have norms, they have regulations, but they norms, regulations, and guidelines are not implemented for the population. So the issue is an issue of delivery. The problem of breast cancer control in the majority of the regions and countries is a problem of access to care and implementation issues. So for that reason, when we were discussing with the Breast Health Global Initiative mentor and founder, Dr. Anderson, he has perhaps one of the, from our perspective, clearest visions about which is the problem. The problem is to face the problem in, 1, a scientific manner, 2, systematically, 3, to communicate this to the medical community, because there are a lot of discussion, but nothing is published. So do you not have, you don't have background documentations in order to go to your Minister of Health and say, this is our situation. Now some scientific documentation is being available. So one of our main concerns and objectives at SLACOM are totally aligned with the objectives of the Breast Health Global Initiative. So that is the reason because we are here, and I understand that the majority of the people that is here is people that is very active in their areas of expertise and through personal actions or institutional actions. So we are sure that this meeting will be extremely productive, because this meeting is for action, not only for discussions and ideas that at the end many times we are disappointed because nothing happens. So we do hope that this will be a real action, and thank you very much, Ben, and all the staff of the Breast Health Global Initiative for your permanent support to the cause. Thank you very much.